All right, well, thank you so much. I'd like to say a quick prayer right now. Lord Jesus, thank you for allowing me to be here among all your precious children. I place a hedge of protection upon each one of them and ask that the anointment of your Holy Spirit be upon me and upon each of them as we share this information. In Jesus' holy name, amen. Thank you.
So, forward will go.
Okay, good. All right, so I was here last fall, and I spent most of my time at that point talking about fall prevention. And so I'm going to go real quick through that information because some of you guys may not have been here. The main thing to know about falls is that 70% of falls are totally preventable. Unfortunately, one of our the ladies that you shared tripped over an electrical cord. Obviously, that was preventable. So what I'd like to do is just kind of reassure you that if we can prevent 70% of those falls, then we just have to worry about those unlikely, 40% things that happen. And so there are some interventions that we can do that can significantly reduce the falls. And so that's going to be this page right here. I'm not going to spend a lot of time on this page. This is what my other talk was about, and we'll be redoing that talk so that way you can have it on video at one point. So real quick, about every 13 seconds, an older adult, and an older adult is considered anyone 65 and older. So yeah, over 65. And those are the people that actually go to the emergency room. Unfortunately, falls are becoming the most common reason why people are coming to our emergency rooms and are sustaining injuries that lead to death. And so we've done a great job with heart disease and other disease processes, and now falls are the next thing that are taking our lives earlier. Many falls are preventable. The number one thing we can do, and we're going to spend some time about that, is get into a good balance and exercise program. The next thing we need to do is we need to talk to your healthcare provider about any falls that you have had, because sometimes a fall can indicate something that is changing within your body. So whether it's neurological, orthopedic, maybe cognitive, maybe stress, depression, there are things that we can do to help you, but you need to let your healthcare professional know that you're having falls or you're having loss of balance. The next thing, and probably one of the more important, is pharmaceutical items. If we take 5 or more medications, we're automatically in a high-risk fall grouping. So those could be prescription medicines or over-the-counter medicines. So it's really important that you're taking your medicine properly and that you are also a little bit louder. Oh, my daughter says I need to be louder. Okay, like that. Is that better, Emma? Okay, good. Okay. So if we can make sure you're taking your medication properly. If it says take in the morning, it's probably because there's something in it that may cause you to feel drowsy. If it says PM, like Advil PM or Tylenol PM, then that means that the medication needs to be taken in the evening because there's a sleeping component into it. So you wouldn't want to be taking that in the morning and then go out to HEB and feel drowsy. The other thing is if the medication says take with food or on an empty stomach, all these are very important. So you need to make sure that your medication is taken properly the way instructed by your doctor. And then have it very organized. Have all your medicines in one spot where you're always going to remember them, and also have your medications in a place where you can check off what you've taken. Because it's very common when you take a pill and then you go and do something, you come back, you're like, oh, did I take my medicine? And so you got to make sure you have a way to check mark it and make sure you don't overtake your medicine. We could probably do a whole talk on just medication, but we're not going to do that right now. Number 4 is have your vision and hearing checked. Vision is obvious. If you're wearing bifocals, sometimes the second lens can cause you to see a little bit blurry, so be careful if you wear bifocals and you're going downstairs or you're looking down towards your feet. If you're doing gardening work or outside work, I recommend that you get single lens glasses, and so you don't have the bifocal component on it because that can cause the distortion in your vision. Also, if you're having some visual changes, glaucoma, cataract, those things, you need to go to the doctor, to your eye doctor every year and have that checked out. Cataracts are wonderful nowadays. They can remove your natural lens and put an artificial lens. And it was so cute. My mother-in-law not too long ago had her cataract removed and a new lens, and she said, you know what, I don't have to wear contacts anymore. I had no idea I was going to be able to see well now. So there's a lot of advancements that are going on with vision. Hearing, although we don't think about hearing and balance, but they go hand in hand. There's been really good studies that show that a person doing balance activities with their hearing aids on and with them off, and they do better when they have their hearing aids on. So it's really important that we remember to wear our hearing aids for better balance as well. Number 5 is keep your home safe. And that's probably the easiest thing that we can do. It's hard to take care of all these other medical issues that we have, but the home safety is something that you can really do quickly. If your family is asking for Christmas gifts, what can I give you for Christmas? Say, I want everyone to come over to my house, take everything that belongs to you out of my house, get the house organized and clean, and things that I do not need to go away. You need to purge and make your home as open as possible. I had one lady that told me, well, these are my beautiful memories. I said, well, these memories are going to kill you because your house is a clutter. And it's so very easy to just not even remember that you have a pile here and a pile there. Before you know it, it's cluttered and you didn't realize it because it's just part of your home. But if you go with a different set of eyes, now we had one lady here that talked about a home health service, that they can actually come and do a home assessment. Take advantage of that. That is wonderful. I also have a book over there. Emma, can you pick up that Check for Safety book? I gave out this book last time, and I have probably about 50 copies. It's that book over there that she's holding up. It says Check for Safety. And with that book, you go step by step through each room, and it tells you what to look at and how to purge your home. Do you have things on the floor, or do you have too much furniture that you have to walk around? Those are common things that people trip over. The other thing, so the 2 reasons why I started giving these talks is, number 1, I did my studies when I got my doctorate on seniors. And number 2, I had way too many patients that were coming to my hospital that had fallen. And my job is to get them up and walk the first time after they've had surgery. And I'd ask them, what happened? And it was always silly reasons. I was wearing flip-flops. I walked into, flip-flops are the devil. I hate flip-flops. I walked into a room that was dark, and my husband put a big box in the way, and I'm mad at my husband. And I said, well, what could you have done? Well, I could have turned on the light, or tripping over an extension cord, or being in a hurry. I had one patient that had a grandchild, and she was picking him up from school, and she was trying to hold her purse in the grandson's backpack and trying to hold his hand, and she tripped on the sidewalk, and she broke her face. She had fractures and all kinds of horrible things. And so we're trying to multitask too much. We're being very busy all the time. And as we age, we get to where we don't bounce anymore. So when we fall, we crack. And so it's very important that we try not to multitask as much. The little ones can hold their own backpacks, and we can try to just be taking care of ourselves more and being a little bit more aware of where we are in space. But keeping your home safe as possible is something that you can do. We could probably do a whole talk on just that, Mary, as well. Okay, next one is talk to your family members and enlist their help. One of the things I've learned with giving these talks to seniors is people, especially from the age 70 and older, they have a totally different work ethic. They have done everything themselves, and they do not feel comfortable asking for help because they feel like they want to be independent, and if they ask for help, that's showing a sign of weakness and showing a sign of losing independence. But the truth is, if you want to keep your independence and you want to age in place and you want to stay in your home and grow old there until our Heavenly Father invites us to come back, then you need to ask for help. And sometimes the help can be very empowering. You can say, I want you to do this, this, and this, and you get those things done. But no more climbing up on the roofs, and no more climbing up on ladders or going up into the attic or standing on chairs or standing on the countertops, or all those things that when we do it, you hear that little voice saying, you really shouldn't be doing this, and you still do it anyway. But so just be extra diligent. Okay, so this talk is specifically about exercise. Now, the very first thing I talked about was get into a good balance or exercise program. But as I understand, the The older we get, the more degeneration we get in our spine and our joints, the more pain we have in our muscles, the more weakness we have. If you look at how the body progresses, at age 0 to 1, there is an increase, an enormous amount of increase that happens in all of our systems and becoming very strong and agile. And if you think about a baby going from being helpless to walking in 1 year, that's really incredible. So the decline in the human body starts at about 30. So we're at our best at about our 20s. Decline starts at 30. At 50, it starts to go down a little bit more steep in women because we have the hormonal changes, so that goes down a little bit more steeper. And then at 60 and 70, it looks really sad. It's like going down like this, and 80 and 90, it's almost like straight down. And so all the systems are declining. We have the skeletal system is declining, our bones, our nerves, our tissues, our everything. But studies show if we can exercise, we may not be able to make it go back up, but we can plateau it. We can make the decrease not be so steep. We can still maintain a lot of our independence and our mobility, but exercise is key. So one of the things about exercising when we have pain is that you want to think about the chronic condition that you may be having, like heart disease, diabetes, or arthritis, and you want to talk to your doctor about what are some limitations. Of course, we always have that disclaimer, ask your doctor before starting. But this is serious. We want to ask them, what are some things that I'm not supposed to do? Like, for instance, if you have osteoporosis, which is softening of the bones, you should not be doing any big jolting activities. If you have compression fractures in your spine where the spine is degenerating and it's cracking, you shouldn't be doing a lot of heavy weightlifting like squats, but you can do leg presses. So there's a lot of different exercises that you can do, but definitely talk to your doctor and say, what are some things that I can and cannot do? Next thing is staying safe while you exercise is always important, whether you're just starting a new activity or haven't been active for a long time. So if you're starting to exercise, be very gentle with yourself. But we're going to start. We've got to get started at this. To play it safe and reduce your risk of injury, begin your exercise program slowly with a low intensity. Next thing is wear appropriate shoes. So if you think about a house, the foundation of the house, if it's crooked or if it's not quite right, what happens with the house? It's tilted or it gets cracks in the wall. So think about your feet as the foundation. Nowadays, there's so many good shoes, there's so many good orthotics, there's so many good foot supports that you can add to your feet. So make sure you invest good money into feet and do not wear flip-flops, please. Next thing is you want to think about the shoe that's appropriate for the surface. So if you get a shoe that has a lot of tread, which is like some of the good hiking shoes and stuff, those are not good when you're walking on carpet because they almost cause you to stumble. But if you're outside walking on concrete, those are fine. So you want to think about the type of activity you're doing and what shoe would be appropriate for that environment. And you can maybe talk to the shoe salesman or whoever is professional around you about that. I can give a talk about shoes too. Warm-up exercise, you want to do warm-up exercise and cool down afterwards. And so warm-up exercise might just be kind of like moving your arms around, just getting your heart to beat, maybe doing a little walking that's a little not so brisk before you start doing your brisk walking, or a little bit of a warm-up movement before you start doing dancing or whatever exercise you enjoy. A quick tip is over-exercising can cause injury, which will lead to you quitting. And so how many of us have got that new gym membership, you went in, you got your new shoes, you got your new workout outfit, and you worked out real hard, and then you're like sore. The second day, you're like so sore, and you're like, I'm never going to go to the gym again. And then I think I read a study that said 64% of gym memberships are not used. Because, everyone buys them at the beginning of the year, and then it's like you get real sore and you went too hard and you quit. And so don't go too hard at the beginning. That will lead to quitting. And also, you want to have a steady rate of progress is really what we want to see. The majority of studies show that if you exercise for 6 months consistently, that becomes a habit. If we only exercise a few weeks and then we quit, you know how many times we've done that. So you really have to be consistent with doing those exercises. Okay, so now that we're going to talk about how to reduce our risk, you want to pay attention to your surroundings when you're exercising, especially if you're exercising outdoors, and now it gets dark at about 5:30. I hate it. I feel like my whole day is gone. I was telling my daughter the other day, it's 7 o'clock, I feel like I should be in bed. It's like so dark. But if you're starting to walk the dog or something and you're wanting to do it after you're done with your day, then it's already too dark outside. So be very careful. I have had patients who have tripped on unlevel surfaces on the sidewalk, and I always ask, what could you have done differently? And they'd say, well, in that case, I should have had a flashlight or something to be able to see. I had one patient during Christmas. She went to go look at the Christmas lights with her granddaughter, and they were all looking around very beautifully, looking at all the beautiful lights, and she tripped and fell and broke her arm. And so again, not being afraid, not living in a bubble, but being diligent and aware that you need to know what's underfoot when you're walking, and having a flashlight now that's getting darker. Drink water before, during, and after your workout sessions, even if you don't feel thirsty. A little bit of sipping water is very important. Dehydration, especially as we age, a little bit of a difference in the amount of water in our system can really cause us to feel woozy. So even a little bit of dehydration can cause you to feel a little bit lightheaded, maybe a little bit of a headache, maybe you just don't quite feel right. My father-in-law was mowing the yard, and it was during the summertime, and he came inside and he thought, oh my goodness, a cold beer would be great right now. Well, he had sweated a lot, and he drank beer. Alcohol dehydrates you. It removes water from the cells, and so he ended up starting to go bad. He was having, sweating profusely, feeling dizzy. They have to take him to the emergency room. He ended up getting an IV. He felt better, but he was suffering from dehydration. And so a little bit of sipping of water is good when you're exercising. Also, dress appropriately for the temperature outdoor if you're going to be doing exercise or walking outdoor, or indoor if it's too hot or cold. Think about what you should wear. Okay, so if you have specific conditions you want to discuss with your physician, okay, Gina, you already told me this, but what am I supposed to talk to him about? These are the 3 questions I want you to ask. Are there exercises or activities I should avoid? And I want them to be very specific with you. One of the things I can say right now is if you have any knee problems, the knee is made up of the top bone, the lower bone, and then the little cap on top. And then on top of that is the muscle that holds it together. If you do the exercise where you're sitting and you wrap your foot around that little weighted thing and you kick forward, I get to be on top. Okay, so have y'all ever been to the gym and you sit on it's called a leg extension machine. You sit down and you wrap your little foot behind this thing and then you kick it forward like this? Don't ever do that. Don't wear flip-flops and don't do that exercise. What that does is it puts a lot of strain right on the patella tendon, and that's when you can rupture the patella tendon or the alignment gets off, and then that bone starts to be kind of rubbing in the wrong position, and that can cause crepitus or the arthritic kind of pain to increase into your kneecap. So I rather you do exercises that your foot is in contact with something. So when your foot is open and there's nothing underneath your foot and you're going like this, that is called an open chain exercise because it's open to the air. Open chain exercises put your knee at a greater risk of injury. You want to do an exercise that's called closed chain, which means your foot is up against something. You've closed that chain. So the gentle leg press, the sit stands, because my foot is against the floor, the elliptical. Treadmill is okay as long as you're not really forcing your knee down real hard. So you want to think about closed chain where your foot's against something rather than open chain where it's open like that. That's the kind of thing I want your doctor to tell you. What are some exercises that I should avoid? So at least you know 2. Is my preventative care up to date? So have you had your bone density exam? Are you taking your vitamin D? There's some new medication injections that can increase your density of your bones. Have those things been looked into before you start your exercises? Are your blood levels okay? Are your sugar levels controlled? Are you monitoring your diabetes? Because if you're diabetic and you have hypoglycemia, if your blood is too high or too low, that can affect how you respond to exercise. So make sure you take care of those things. Also, how does my health condition affect my ability to exercise? And so those are the three questions you want to ask. And it is on this little paper right here. I included it on those notes that I gave you. Okay, so now your doctor says, okay, you're good to go. You have some arthritis, you have some heart disease, but we're okay. We got you all controlled with all that stuff. You can start exercising. Okay, you want to pick an exercise that you are going to like. And I cannot tell you which exercise that is because everyone's individual. My father, when he started exercising in the Navy, he did ping pong. So he decided he wanted to get into a ping pong group, and he did that up until he couldn't do it anymore. So for him, it was ping pong. My mother likes to walk, so that would be more appropriate for her. Is people like to dance. You want to think about exercises that that are social, probably if you're a social person, and something that you'll keep up with. Remember, we want to do it at least for 6 months in order to really see some significant improvement and make it a habit. Be creative about your exercise activity, plans, and regularly try new forms of exercise to prevent boredom. There's one exercise, it is called Crossfit. And CrossFit is interesting because what they've identified is if you do an exercise, and so they do crazy things, like they have these huge tires, those big tractor tires, and they flip them over, and then the next day they're doing jump rope, and the next day they're running sprints, and so what they're doing is they're working the body in a lot of different ways. And what they have found, the exercise physiologists have found, is if you keep changing it up, the body responds quicker. Because that's how God made our muscle cells. He made them to where if they don't become so used to the same exercise, because God made our bodies to where we can become efficient. So if I swim a lot, initially I'll have a lot of response to my muscles, but then it gets easier all of a sudden. And what's happening is that those specific muscles have become used to it and they've become efficient with doing that particular exercise. But if you switch it up and do another exercise, then a different group of muscles, a different mechanical way of working has to kick in, and so now you're working them in a different way, which also increases their strength. So what you want to do is you want to change it up, not only to make the muscle strong and more active, but also so you don't get bored with it. And so you can enjoy your activities and you can do something new. Also, if you can stick with it at least 6 months, it's a good sign that you're on your way of making physical activity a regular habit. Okay, so I'm going to talk real quick about 3 of the most, easiest and best exercise for seniors. Tai Chi. So Tai Chi involves a series of movements performed in a slow, focused manner and accompanied by deep breathing. So right now, I'm going to teach you guys how to do deep breathing. After surgery, I ask my patients, take a deep breath, because after surgery, we have to make sure we get all that anesthesia out and any little bit of mucus out, because if we don't, it can cause pneumonia. But this is also good for us to learn all the time. So I'm going to deep breathe first, and then I'm going to have you deep breathe next. So what you're going to do is when you take a deep breath, I want you to breathe in through your nose very slowly, and I want you to breathe in a way that you feel the air expanding your lower lungs. So if I take a little quick breath, I'm only using these lungs right here. I need to get these lower lungs opened up. So I'm going to go, and it almost makes you kind of lift up, and then when you blow out like you're blowing out a birthday candle. So inhale real slow through your nose and feel this opening up, and hold it, and then blow out a birthday candle. And if you do that first thing in the morning and it makes you cough, that's wonderful, because if you have a little bit of congestion and it starts to kind of build up in there, that can prevent pneumonia, especially if we've been laying down a lot or not so active. So let's do 2 more times. Breathe in through your nose, hold it, and then blow out. There's a lot of ideas about mindfulness and all these things, and I'm not really into that. But I think the main thing is they incorporate breathing in the breath. And the reason breathing is so important is because when you inhale, you're taking in oxygen, and that helps your blood to pull in that oxygen, and it takes it to your muscles. And so if you're exercising, you want to have more oxygen into your muscles. So when you're exercising, think about that deep breathing. Tai Chi does that. They talk about the whole deep breath. Tai Chi is a low impact, and it puts minimal stress onto your muscles and joints. It's generally safe for all ages and fitness levels. In fact, Tai Chi is a low impact exercise, and it may especially be suited for older adults who otherwise may not like to exercise. The reason I like Tai Chi is because the balance effect. Those people who have a low balance and who have a history of falls, Tai Chi is what they need to be doing. So what Tai Chi does is, have you ever seen karate when they do like punches? So what's going on is they're coming forward, they're shifting their weight, and then they're doing a punch. What Tai Chi does is it actually causes you to, it asks you to do that same movement, but in slow motion. So one thing about Tai Chi is it's kind of boring. Because you're like, really, this is exercise? Okay. And extend. So what's happening? I'm standing on this foot, I'm extending this foot, I'm making contact with my heel, I weight shift, I think about my abdominal muscles, I breathe, I twist. That's what Tai Chi is. And there's a lot of aspects of Tai Chi. I've only done a Tai Chi class one time. I'm telling the truth about that because I thought, this is so boring. Maybe when I'm a little bit older, I'll do Tai Chi. But studies show people that do Tai Chi are 70% less likely to fall down. So if you have a balance problems, Tai Chi is where it's at. You can do Tai Chi, you can go online. There's a YouTube thing, it's called Tai Chi for Better Balance. There's one, it's called Tai Chi for Arthritis. The Tai Chi for Arthritis is good because it incorporates a chair. So if your balance is kind of poor, you can actually do some of those movements holding on to a chair, and then eventually, hopefully, weaning off of using the chair. There's videos you can buy, there's classes at the senior centers. If you want to start doing Tai Chi here, this is an excellent room, Mary. Y'all can start doing Tai Chi. So some of the evidence, there's lots of studies that have been looking at Tai Chi. These are the things that they are claiming happens when you do Tai Chi. It enhances your quality of sleep. It enhances your immune system. It helps lower your blood pressure. It improves joint pain. It improves symptoms of congestive heart failure. It improves overall well-being, and it reduces your risk of falling. So that's Tai Chi. Okay, another exercise. I like this one because it's pretty easy. You don't really have to pay for it, and you just need to find a safe place to walk. You can walk on a treadmill, or you can walk out and about. I have lots of good studies that talk about walking and the benefits of walking, and I do have this paper back there if you're interested in looking at studies and such. But one of the things it says about walking is walking can add years to your life. A 2015 study by St. George University Hospital, researchers found that walking 25 minutes a day added up to 7 years to participants' lifespan. Walking prevents and reduces pain from arthritis. If you have arthritis, you might think that walking may be too painful to do regularly. Multiple studies, however, have found that walking actually reduces arthritis pain. Walking lubricates the knees and hip joints, strengthens surrounding muscles, reducing the strain placed on the joint itself. Walking reduces risk of elderly disability. Let's see. Regular walking reduces elderly adult disabilities by 41%, helping participants maintain their independence. That was by the University of Georgia 2008 study. There was another study that identified that it does help with cardiovascular health. Of course, we know that with reducing heart disease, blood pressure, high cholesterol, diabetes, stroke, cardiac arrest. Even small amounts of walking each week have been shown to reduce 15 to 20% of problems associated with cardiovascular health. Walking can help fight weight problems. I like this one. This one says that researchers at Harvard who study genetic links to obesity have found that 1 hour of walking a day cuts the effects of 32 obesity-promoting genes in half. So my daughter's always trying to get me to run and walk, so after reading that one, I have to walk for an hour, honey, I admit it. The last one I want to share with you is it can boost your immune system. Studies have found that regular walkers get sick less frequently. One study discovered that people who walk 20 minutes a day, 5 days a week, took 43% less sick days compared to those who did not exercise. So walking is very, very wonderful. So the things that I have here that walking can do is you want to walk. Walking is easier if you stick with it. It improves your cardiovascular health. It helps fight weight problems. It boosts your immune system. It reduces risk of elderly disability, and it can add years to your life. All right, let's see what other exercise is good. Dancing. All right, so here are some studies that I found about dancing. I also have that handout back there too. Okay, so there was a researcher in Australia, and they found that dancing can decrease depression. Women with mood disorders who participated in 2 weeks of tango instructions felt less depressed and experienced significant reduction in their levels of stress, anxiety, and insomnia. There's another one talked about salsa. A study published in the Journal of Gerontology, salsa proves to be a safe and feasible exercise program for older adults. The authors found that they noted high adherence rates to the program. Over 92% of the seniors who started ended up completing the 8-week salsa dance regimen. Also doing soft shoe, which is, of course, the easy, softer way of dancing. St. Louis University study found that after engaging in 12 weeks of low-impact dance program, participants had at the average age of 80, were able to decrease the amount of pain medicine that they were taking by 39%. They also were able to move easier. Waltzing also was found to help the heart. In this study, they said that people with stable chronic heart disease may derive the same aerobic health advantages from learning how to waltz as they would with traditional cardiovascular disease, such as cycling or walking. And this was published in the Journal of Circulation. And then the last one, I like this one, is defending against dementia with disco. According to 21, this is a really good study. This was done by the Albert Einstein College of Medicine. According to a 21-year study, aging adults who danced regularly had a 76% reduced risk for developing dementia. And that was a 21-year study. So that was very significant. So I think you need to have Tai Chi and then dance parties here, Mary. Okay. You can do it in spite of your health issues: Parkinson's disease, dementia, cancer, arthritis, asthma, heart disease. What do all of these conditions have in common? They don't prohibit you from dancing. Research into dancing also as a therapy for each of these ailments has unearthed a host of advantages with very few risks. So, it says here, dancing can reduce depression, stress, anxiety, insomnia. It increases older adults' strength and balance. It reduces stiffness and reduces need of pain medicine. It's a great cardiovascular exercise, and it defends against dementia. All right, Emma, so we're going to be dancing in the kitchen more. All right. So I gave you all this handout as well, okay? So the National Institute of Health and Aging have a really good website. It's called Go for Life. And that's also the company that I'm going to show this off real quick. This was provided by through the NIH for free. I ordered 50 of them, and so you can order more if you need to. But they're really allowing for the American public to have access to lots of good information for exercise. So they have a really good website. It looks like they even have an app if you wanted to get into that app, and they can instruct you on how to keep track with your exercise routine. And so there are 4 things that you want to think about. You want to think about endurance, strength, balance, and flexibility. Endurance, when you're doing any type of exercise, you want to listen to your body. When your breathing becomes faster, but you should still be able to talk. So when you're exercising, if you're and you can't catch your breath, then you're exercising too hard. It shouldn't. You should be able to still have a conversation and you're breathing and you're talking. You shouldn't talk all the whole time, but at least if you can still answer questions and be able to have a breath while you're talking. If you cannot, you're consuming too much oxygen, and so you need to slow down a little bit. So as you know, they say you should exercise for 30 minutes. But the 30 minutes, studies have shown it doesn't have to be all in one duration or all at one time. You can break it up into 3 pieces. So if you exercise for 10 minutes in the morning, and maybe that's all you can do because of your endurance or your discomfort, 10 minutes again in the afternoon, 10 minutes at night, that equals a total of 30 minutes. That's sufficient, and that could help you to increase your endurance. Strength. You may need a chair to do many of the strength exercises on this website. I just felt like this was a good resource, but you could do any type of strength exercises. Be sure that you choose a chair that is sturdy when you're doing some of the strength exercise. So the strength exercise may include some dumbbells, it may include cans of soup, it may include rubber bands. Whatever exercise program you get, you want to incorporate some amount of strength, resistive exercise. When astronauts go up into space, there's no gravity, and what happens is they don't have that pressure against their bones, and when they come back to Earth, they found that they were very osteoporotic and very prone to fractures. So their bones got kind of soft without that gravity. So what they found is that in seniors, as our bones are a little bit softer, if we add a little bit of that resistance or that pressure, it builds up their strength. And so when you're thinking about the strength exercise, we're doing it for our skeletal system as well as for increasing our strength in our muscles. Balance is another part of exercise that you want to make sure that when you're doing your activity, you incorporate. Have that sturdy chair handy or a person nearby to hold on to you when you're doing your balance exercise. And that little blue book that I passed out to you guys, it does have some balance activities. It has the single leg standing, and it has the eyes open and the eyes closed. When you do the eyes closed, be sure to be holding on to something, because the eyes closed, what's happening is when your eyes are open, you can see where you are in space, and so you're getting that input into your brain that's telling your body, okay, shift like this and do these things to stay upright. When you close your eyes, totally changes, because now the only thing that's keeping you up is how you feel. And if you're not used to doing a balance activity, when you close your eyes, suddenly you're like, whoa, it's hard to keep my balance. The good news is that if you practice that within a couple of days, you'll find that you get better. You're like, eyes open, eyes closed. Oh, look, I can hold it a little bit better. That's the great thing about our bodies, is if we train, it learns pretty quickly. So that whole idea of exercising with your eyes closed is because sometimes the proprioception, we have to not have our vision. So walking into a dark room, or walking outside when it's not so illuminated, or walking when you're kind of drowsy and you don't have your eyes open so wide. And so all those things can help. Flexibility. Always warm up before stretching exercises. A few minutes walking around helps. And so when you get into an exercise routine, just think about, you want to do something that has endurance, strength, balance, and flexibility. If you're not quite sure what that looks like, look at that little blue book I gave you, or go online and look at this site. Okay, I'm almost done. Exercise without spending money. It shouldn't cost anything. So if you're doing if you're dancing in your kitchen, you're dancing at Concordia at the dance that Mary's going to have in May. Or, so whatever you want, whatever you do, you don't have to use money as an excuse. Doing the activity as much as you can, but it needs to be something you enjoy. All you need is a brisk pair of walking shoes. Oh, I do recommend you do spend money on good shoes. That's really important. For strength training, you can save money by making your own weights using soup cans or bottled waters. Check your local Parks and Recreation Department or Senior Center about free to low costing exercise programs in your area. All right, so no more excuses. Now, even if you get a little fatigue, then you stop. But what you do is you always try to be consistent with your exercise program. I think Pastor's sermon was about being lazy or something, wasn't it? I agree. It's hard not to be lazy. You know, we're so busy and we have so much activity going on, but we need to make exercise part of our regular everyday routine. Exercise can also reduce depression. It improves your mood and overall well-being. Once you become active, you'll find that you have more energy. So that's a good thing, is I don't have energy to exercise, I'm too tired. But if you exercise, it actually gives you energy. So try thinking about that. And then also, as you do more, you may also notice that you can do things more easily, faster, and for longer than before. And when we talked about aging, we want to age in place, we want to continue to be independent, and so these all go hand in hand with being safer. So number one quick tip is be consistent. So a little bit every day, all the time. For how many months? 6 months. And respect your pain. If you're having pain, maybe you push too hard. Maybe you shouldn't do that exercise. Or maybe you should take your pain medicine before you do some of these exercises. If you do take pain medicine, take it as prescribed. Do take it at least 45 minutes before you start your therapy or activity, because that'll help take the edge off so you can do some of it. But don't take so much medicine that it masks your pain, and then when it wears off, you've hurt yourself. Okay, so this is on the back of your page here, or the second page. A real quick synopsis on everything we've gone over. The steps to safe exercise when you have discomfort is number 1 step, the 3 questions that you're going to talk to your doctor about. Number 2, you want to take your medicine correctly, get good shoes, and do your activity in a safe environment. Number 3 is choose an activity and a friend that you like. If you do the activity with a friend you like, then you're probably going to want to get together and do the activity. Step 4, start off slow and build up gently with the intensity and the time that you spend doing your exercise. And then the last one is respect your pain. All right, do you have any questions? If you want to start doing a walking program but you're concerned about your balance, you can use a cane or a walking stick. Use it on the side opposite to your bad leg. So if you have a bad right knee, my right knee is bad, so I'm going to walk like this. What side do I use my cane? Left hand. So when you're walking, the left side gets a little bit of support when it's going to be stepped upon. And also it keeps your spine more upright. All right. Well, God bless you guys. Thank you so much for having me again. Bye-bye.